What's up everyone, how we doing? I am Dr. Nathan Hoffman. I am the owner of the Chicago Dental Studio. I am the head dentist and I emphasize and specialize in cosmetics. We're gonna go through a case presentation today. If you have something specific that you wanna change or improve with your smile and you've gone to a few consultations but you're not exactly sure what to do, I hope this information helps. So if you have some specific questions as a patient or as a doctor and you wanna message us questions, I'm happy to talk to you as well. It's my opinion that as long as there's healthy tooth structure, I don't always recommend doing a full coverage crown. What a full coverage crown is where you have to drill the tooth down and then put a ceramic that completely goes over it. Nothing is as strong as the tooth structure itself. In fact, what usually I do is do almost like a veneer that goes on the front of it, but then I also wrap around the sides. So if you think about that tooth, now it's got body armor on the front of it and its side, and the back is open. And the reason for that being is because this is your top front tooth, like this one right here, and the lower teeth, they go like this. So the forces are gonna be going outwards like this. So if you have ceramic here, here, and here, it protects the tooth. What it wouldn't protect it from is necessarily flexing in this way, but that doesn't happen because our mouths don't move that way and teeth don't bend that way. You can be really conservative while also protecting the tooth, and that's in the patient's best interest for the long term. Root canals have a tendency to fail. The root canal seal can break, bacteria can get underneath it, and then the tooth gets a new infection, and then you have to redo the root canal. So with this mindset, I think it's always important to plan for failure and plan for the what if, for yourself and for the patient. When you have the back exposed, that's where they access for the root canal. So now you can have the root canal redone and you don't have to compromise the ceramic. If you do a full coverage crown, the only way to do it is then drill through the crown that you've just had done, and then more likely than not, it has to be replaced. Sometimes people repair them, but realistically, nothing really seals to ceramic, so you're gonna eventually get micro leakage and have more issues. And in this case, we were talking about doing some enhancements, and really the patient wanted to keep things super conservative and only wanted to do as little teeth as possible. However, in this particular case, you might have to do more teeth depending on what the patient wants, and I'll explain why. Two reasons here. Number one is the shade of the tooth. So if you look, you're gonna see that this tooth, the tooth that had the root canal, the tooth that had the accident, is much, much darker than the other front tooth. You want to use ceramic with translucency, which means light shines through it. And the reason why you do that is because our teeth are translucent. So the only way to get it to look real and get it to match is having that translucent ceramic. However, when you have a tooth that's got a dark tone to it, what will happen is the light will shine through, it'll capture that dark tooth. What happens is the darkness shows through and you don't get a perfect color match. So what you do to account for that as a dentist is you use a more opaque ceramic, and opaque ceramic means light bounces off of it. The light bounces off the ceramic, the dark tooth behind it is then blocked out, and you can effectively get rid of the dark tooth. But color to most cosmetic dentists is a lot of different elements that go into make the perfect match. One thing is the level of brightness, and even if you get a perfect match, the tooth's gonna look bright, the patient's gonna be frustrated. In this situation, the patient wanted it to be perfect, so then we did two teeth in order to match the color. So this patient had a gap right here in the smile, and he wanted to close it. This tooth here to then where the gap is closed versus this tooth, the width here is gonna be greater than here. So then what would happen is by doing that, this tooth would look a little bit bigger. The color might not be perfect because of the opacity of the ceramic we have to use. Do we want that? And the patient said, I want it perfect. So we did two teeth. By the result that we're able to get a really natural look on just doing the front two teeth. I would argue if you would look at this after without seeing anything before, it'd be almost hard to pick out which teeth we actually did. You'll also see that now the color match is seamless, where it not only matches with its partner, but also it actually matches all of the other teeth. If you get up close and personal here with a blackout screen, you can see that. We added some translucency, we got warmth, and we got all the tones of the teeth that we want to have. You're going to have perfect symmetry and balance because the shape is the same and specifically the width is the same as well. And now you have a happy patient. A root canal is basically a procedure that's done when the nerve inside the tooth and all the blood supply either becomes so inflamed that it won't heal itself or it becomes dead and necrotic. And when that happens, there can develop an infection. That nerve, we call it the pulp, that area of tissue or the chamber in canal is cleaned out, sterilized, and then sealed with something to prevent bacteria from getting back in. Just because a tooth gets darker doesn't mean it needs a root canal. Teeth can go two ways. One is it can become necrotic and die, and usually the color that's going to change is like black and gray. More times than not, those teeth need to have a root canal. You should still see someone get testing, etc. If the tooth turns a very tan or brown, that actually means that it's becoming calcified. And so what the body or the tooth does is it builds like reparative dentin, which is a tooth material inside the enamel, and it basically kind of like body armor up, and what it wants to do is protect that nerve. But by doing that, it almost densifies the tooth, and then that nerve canal that I just mentioned is almost insignificant. So if you took an x-ray, you wouldn't see like the radiolucent or gray nerve. Always look at the x-ray, make sure it's not calcified. Tan brown usually means that it is, and those are indications that you don't do a root canal, even if it doesn't respond to cold. It's not that it's dead, it's just the nerve is so now small that it's not going to feel the cold. The only concern is that it's cosmetic, but the patient's not going to like how it looks. Then you use restorative dentistry to cover it, and you're good.